Every 66 seconds, another senior in this country is told they have dementia. By the time this video concludes, 20 more families will have heard those words. And for some of them, age was not the cause. It was a bottle on the bathroom shelf, a product they were assured was safe. I am Dr. John Myers. With 15 years of practice, I've seen this exact scenario unfold more times than I can count. Someone sharp their whole life starts losing their train of thought. Names, appointments, the drive home they've made 1,000 times, and everyone around them calls it getting old. It wasn't. It was a medication. One almost nobody questions because a doctor prescribed it and a pharmacy filled it. Here's what newer research consistently shows. One ordinary, everyday class of drug can significantly impair your memory and learning within a single year, and most people taking it have no idea it's happening. Today, I'm guiding you through the 9 medications most closely linked to rapid memory loss. We'll count them down from those often overlooked to what I consider the most damaging. Watch for number 3. It's given to millions of seniors for something that sounds completely harmless, and it may be shrinking the memory centers of your brain right now without any warning signs. Before we begin, please tell me in the comments how old you are and which medications you take daily. I read them, and the age of this audience influences what I cover next. Let's start at number 9, and don't let its low ranking fool you, because this one is in almost every medicine cabinet in America. Number 9 is diphenhydramine. You know it by its drugstore name, Benadryl. It's the little pink pill people reach for to fall asleep, to calm an allergy, or to ease cold symptoms. It costs a few dollars. It's available openly, and most people assume that because no prescription is needed, it must be gentle. Inside your brain, it's doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That's a complex term for a simple concept. They block a brain chemical called acetylcholine. Acetylcholine is the messenger your brain uses to form new memories and to stay alert throughout the day. As we age, the brain produces less of it and relies more heavily on what remains. Therefore, a drug that blocks it affects a 70-year-old brain far more than a 30-year-old one. The area that suffers is the hippocampus, the small, seahorse-shaped structure where new memories are created before they are stored. In my practice, I've observed patients taking a nightly antihistamine for years, slowly losing their edge, and never connecting the cognitive fog to the pink pill by their bedside. The research clearly links them. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who regularly used anticholinergic drugs and found a 54% higher risk of developing dementia compared to those who didn't take them. That's more than half again the normal risk from something most of us treat like candy. Here's what to do. Read the label on anything you take for sleep or anything marked PM, nighttime, or allergy relief, because those are very often just Benadryl under a different name. If you take it for allergies, there are newer antihistamines like loratadine, sold as Claritin, that don't enter the brain the way Benadryl does and are much safer for the long term. Never stop a medication on your own. Discuss it with your doctor. But stop assuming that over-the-counter means safe for your memory. That's number 9. Number 8 is one your stomach loves and your brain quietly pays for. Number 8 is the proton pump inhibitors. The prominent names include omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These reduce acid production in the stomach and are prescribed for heartburn, reflux, and the burning sensation after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms return intensely. Thus, it feels like the drug is the only thing providing relief. Here's the information almost nobody hears at the pharmacy counter. Your stomach needs acid to extract certain nutrients from your food, chief among them being B12, which protects the wiring of your nerves and your brain. Reduce the acid too much for too long, and your B12 levels will drop unnoticed. Magnesium and calcium also decline. 2 minerals your brain cells need to function and communicate effectively. Deprive the neurons of these, and you experience misfires, confusion, and memory lapses that precisely closely mimic early Alzheimer's, when the actual cause is a nutrient your medication has been blocking all along. In 2016, a large study in JAMA Neurology examined over 73,000 individuals aged 75 and older. Regular PPI users faced a 44% higher risk of dementia compared to those who did not take them. And the issue extends beyond nutrients, as PPIs have also been shown to increase levels of amyloid beta in the brain, the sticky protein that accumulates in Alzheimer's disease. So here's the recommended action. If you take a PPI daily, that's a conversation to have with your doctor. Many individuals can gradually reduce their dosage to a milder class called H2 blockers, like famotidine, sold as Pepcid, which is far less likely to impact cognitive function. Chewing deglycyrrhizinated licorice, a natural compound that coats and soothes the stomach lining, can alleviate symptoms without any cost to the brain. The objective is the lowest effective dose for the shortest duration, not a pill taken indefinitely out of habit. Number 7 is prescribed for a condition most people prefer not to discuss. Number 7 is the bladder drugs, and the one to know by name is oxybutynin, sold as Ditropan. It is given to seniors who experience a sudden, urgent need to use the bathroom, the kind of overactive bladder that can disrupt an entire day. The relief is genuine, and the embarrassment it prevents for people is also real. However, oxybutynin works by blocking acetylcholine, the same memory chemical that Benadryl blocks. And this drug easily crosses into the brain, affecting the very areas where memories are formed. This makes it one of the more concerning medications on this list for older adults, especially when taken consistently for months or years. In 2019, the British Medical Journal published a study of individuals over 65 who took potent anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher, close to 1 in 2. And here's what concerns me most. Almost none of them received a warning. They were told a pill would help their bladder. No one mentioned it might also be impairing their mind. The cognitive fog is blamed on age. People describe forgetting appointments, misplacing their keys multiple times a day, losing the thread of simple conversations. And everyone around them nods and says, "Well, you're getting older." It's rarely traced back to the prescription until significant cognitive decline has already occurred. If you are taking oxybutynin and have noticed your memory faltering, take that seriously, because you don't have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Myrbetriq, work through a completely different mechanism and do not block acetylcholine at all. For most older adults, they offer the same bladder control with significantly less risk to cognitive function. Discuss this at your next appointment. Number 6 might be the most surprising on this list because it's one of the most widely prescribed drugs globally. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most frequently prescribed medications worldwide, particularly for those over 60. They play a vital role in lowering cholesterol and reducing the risk of heart attacks and strokes. Statins are appropriate for many individuals, and this discussion is not an argument against them. What follows is the aspect of their impact that is often omitted. Cholesterol does more than affect your heart. Your brain is nearly 60% fat, and it uses cholesterol to construct the myelin sheath, the insulation that surrounds every nerve, allowing signals to travel quickly and clearly. If cholesterol is lowered too drastically with a potent statin, the brain can be deprived of a crucial building material it actually needs. The statins that cause the most issues are those that readily penetrate brain tissue. In 2023, a study in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for over 3 years experienced a 26% higher rate of mild cognitive impairment, and the higher the dosage, the more pronounced the decline. Some patients reported disturbing memory gaps, forgetting familiar names, conversations they had just finished, or routes they had driven for 20 years suddenly becoming unfamiliar. The key takeaway is that not all statins affect the brain in the same way. Pravastatin and rosuvastatin do not readily enter brain tissue and are generally considered safer choices for cognitive health. So, if you have been on a statin for years and are experiencing cognitive fog, forgetfulness, or confusion, that's a valid conversation to have with your doctor about potentially lowering the dose or switching medications. It's not a reason to discontinue a drug that may be protecting your heart. Develop a proper plan with professional guidance, never independently. A brief pause. If this information is resonating with you, please take a second and tap the like button. It genuinely helps this reach more seniors who need to hear it. And while you're there, tell me how many prescriptions you are currently taking. I read every comment. All right, back to the countdown. Number 5. Number 5 is the benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most prescribed drugs in America for anxiety and sleep issues. They function by enhancing GABA, the brain's natural calming signal, which reduces a racing, overstimulated nervous system. Initially, they feel like a relief. Panic subsides, racing thoughts cease, and sleep finally arrives. Over time, the situation changes. A 2022 study in the British Medical Journal followed over 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of Alzheimer's disease. The longer-acting ones, like diazepam, were more problematic because they remain in the body longer and accumulate in fatty tissues, including the brain. The drug's action is a gradual chemical sedation of the entire brain. Learning new things becomes slower, and the brain becomes less flexible. Many individuals describe a sense of flatness, moving through a fog, and not feeling entirely like themselves anymore. The most difficult aspect is stopping. Discontinuing a benzodiazepine abruptly can cause anxiety and insomnia to return with twice the intensity, along with agitation that can be genuinely dangerous, making the pill seem essential precisely when it is causing the most harm. So here is a crucial rule. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly, as this can be life-threatening. Work with a doctor to gradually reduce the dosage over weeks or months. Milder alternatives exist, such as buspirone for anxiety, which does not cause sedation or mental cloudiness, and a specific form of talk therapy designed for insomnia and anxiety that brings calm without cognitive impairment. Number 4 is a single pill prescribed for 3 different conditions, and it carries one of the most significant hidden burdens of all. Number 4 is amitriptyline, sold as Elavil. It's an older antidepressant still used today for nerve pain, sleep issues, and even to prevent migraines. Its versatility is precisely why it has spread so widely and quietly. It appears to be a versatile medication. Beneath the surface, it is one of the most potent anticholinergic drugs still in widespread use, meaning it strongly blocks acetylcholine, the very chemical your neurons need for communication and memory formation. It blocks it so effectively that with long-term use, the impact on memory transitions from a rare side effect to an expected outcome. In 2015, a large study in JAMA Internal Medicine followed over 3,400 adults aged 65 and older. Those with the highest cumulative dose of anticholinergic drugs, like amitriptyline over 10 years, had a 54% greater chance of dementia, and nearly all of them were never informed that the pill could have this effect. They received it for sleep or pain, then gradually noticed words disappearing, memory fading, and concentration wavering, attributing it to age. It doesn't even require a high dose. A small nightly dose taken for years can subtly diminish brain function with no apparent symptom until the loss is significant. If you or a loved one takes amitriptyline, this is a conversation worth having soon. For nerve pain, options like duloxetine or gabapentin can provide similar relief without the same anticholinergic effects. For sleep, melatonin or a very low dose of doxepin, which is much milder on this chemical system, can serve as alternatives. And for mood, newer antidepressants like sertraline or escitalopram are considered much safer for long-term brain health. Number 3 is the one I advised you to watch for, as it's given to millions for something that sounds harmless. Number 3 is paroxetine, sold as Paxil. It's one of the most prescribed in a family of antidepressants called SSRIs, used for depression and anxiety. On the surface, it appears to be a modern, gentler option, kinder than older psychiatric medications. Here's the detail they rarely mention. Paroxetine is the only SSRI with significant anticholinergic activity. This single fact distinguishes it from its counterparts like sertraline and escitalopram, as it affects the same acetylcholine system that every other drug on this list has been impacting. In 2021, a comprehensive review in Frontiers in Psychiatry examined older adults on various SSRIs and found that paroxetine users exhibited measurable decreases in short-term memory, word recall, and attention within the first 12 months. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment than those on other antidepressants. There's a harsh irony here, as the drug is prescribed to stabilize the mind, yet over time, it can degrade the very clarity it's intended to protect. The solution here is straightforward. In older adults, paroxetine is one to avoid. The American Geriatric Society has included it on the Beers list, an official catalog of drugs considered risky for seniors, and paroxetine is on it for precisely these reasons. If you take it, ask your doctor about switching to a safer SSRI like sertraline or escitalopram, which are gentler and do not carry the same cognitive risks. Supporting your B vitamins, especially B12 and B6, can help naturally stabilize mood alongside that change. Number 2 is so discreetly prescribed that many individuals taking it have no idea what type of drug it even is. Number 2 is the antipsychotics, and this one troubles me the most because so many people taking them never consented to an antipsychotic prescription. The names include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. They were developed and approved for severe psychiatric conditions like schizophrenia and bipolar disorder. Today, they are frequently prescribed off-label to older adults for sleep, mild restlessness, or the agitation that can accompany dementia itself. Potent medications meant for severe illness are now used in homes and nursing facilities on seniors who are simply confused, restless, or difficult for busy staff to manage. The consequences are severe. In 2022, a study in Lancet Healthy Longevity tracked over 25,000 older adults and found that those given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even without a prior history of dementia. These same drugs also increase the risk of stroke, sudden cardiac death, and severe sedation that leads to falls and hospitalizations. They function by suppressing dopamine, a chemical linked not only to mood, but also to focus, planning, and memory. When dopamine levels drop significantly, the brain becomes slow and unresponsive, which is why individuals on these drugs can appear dull, withdrawn, almost absent, while their families grieve for someone who is still physically present. If you or a loved one is taking one of these medications, the first step is to ask the prescribing doctor a direct question. Why was this initiated? And is it truly necessary, or is it for convenience? Most behavioral symptoms can be managed without medication through consistent daily routines, reduced noise and overstimulation, addressing underlying pain, and optimizing light and sleep. When medication is genuinely required, the lowest dose for the shortest duration minimizes harm. Far too often, families are never informed about the drug's impact on the brain, and they witness a decline they attribute to aging when the cause is chemical. Number 1 is not a single drug, but a phenomenon, and it may be the most significant hidden contributor to every story I've just shared. Number 1 is anticholinergic polypharmacy. It's the danger almost no one names, and may be one of the leading causes of drug-induced memory loss in older adults. You were likely anticipating a final villain, a single worst pill. The true worst-case scenario is something more subtle: the cumulative effect of taking several anticholinergic drugs simultaneously without anyone calculating the total impact. Polypharmacy simply means multiple medications at once. An anticholinergic burden refers to the combined effect of all of them blocking that single memory chemical. Consider a common situation. A senior takes Benadryl every night for sleep, oxybutynin daily for bladder issues, and amitriptyline for nerve pain. Individually, each might cause only a minor, barely perceptible dip. Taken together, they compound, and the total burden on the brain escalates rapidly. In 2022, a study in Age and Aging tracked over 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double. And the vast majority had no idea they were taking anticholinergic drugs at all. No one had ever explained it to them. When acetylcholine is blocked from multiple sources simultaneously, the brain doesn't just idle. Neurons begin to deteriorate from disuse, connections weaken, and the brain settles into a subdued, underpowered state that tests almost identically to Alzheimer's. Here's the hopeful aspect, and the reason I created this video. Drug-induced cognitive decline is often reversible when identified early. Reduce the burden, and many individuals regain their clarity, energy, and memory within weeks or months. The brain is more resilient than we credit it for, but only if you remove what is harming it. The solution doesn't require a miracle, it requires a careful medication review. Sit down with your doctor or pharmacist and have them examine every prescription, every over-the-counter pill, and every supplement and calculate the anticholinergic load. Simple scoring tools exist for this purpose. Once the problematic drugs are identified, you can gradually discontinue what you don't need, switch to safer alternatives, and allow the brain room to recover. This is the most preventable threat to the aging mind on this entire list, and that is precisely why it is ranked number 1. Now, I want to hear from you. Of these 9, which ones are currently in your cabinet? Have you noticed brain fog or forgetfulness appearing after starting something new? Please share below and tell me you will request a medication review this week. Your response might be what saves the next person who reads it. And before you go, there's another place your body signals warnings. Your medicine cabinet is one, and your hands are another. Your fingernails can indicate issues with your kidneys, your blood, and even your nervous system, years before any other signs appear. And most people never know what to look for. That's the topic of the next video. I'll show you the 4 nail signs worth checking tonight. I am Dr. John Myers. Stay sharp, and I'll see you there.